Hello and welcome to the Growth Paramedic channel. This is the Pharmacology class, and today we are going to be talking about Ondansetron. So a bit different from the other medications that we have covered already in the past videos. But before we begin, as per usual, we're going to do a quick disclaimer. So this channel is for educational purposes only, and it's not intended as medical advice. While I'll always strive for 100% accuracy, errors may occur, and medications and protocols do change over time. So please do not solely rely on information provided on this channel, but as additional reinforcement to your learning either at paramedic school or on road as a practicing clinician or as a paramedic. Okay, perfect. Now we've got that out of the way, let's talk about Ondansetron. So let me underline this for you. This is the introduction part of the class, so as per usual, we'll structure it the same way as we have in the previous one. So we're going to talk about the definition. This definition today should be quicker than the past few ones that we've done. We'll also talk about the pharmacodynamics, so how the drug works in the body, dynamics, and also the precaution that you should be aware of, or what I believe that you should be aware of if you're going to administer the medication. And as per usual, all this will be time stamped. So if you are in a rush or you need to quickly go to a certain area, you need to know about the pharmacodynamics, you can just quickly skip this. So this is going to be the introduction part. If you like the videos and you found them helpful in whatever way, please do feel free to like and subscribe. I will be trying to upload quite regularly. And if you have any topics that you want me to cover, or any medications that you think I've missed, just comment in the videos, and I'll make an effort to make those videos in the future. Okay, perfect. So that's the introduction out of the way. Let's go into the definition of Ondansetron. Now, I always found the name quite amusing because it sounds like one of those Autobots, you know, those kind of Transformers things. It's quite a weird sounding medication, but it does have a lot of usages in the pre-hospital setting, and it has been used. Well, I've definitely used it in the pre-hospital setting, so it is one that you should be comfortable knowing about and using if you need to. Okay, so let's go to the definition. So I might make that, actually that's a bit too thick. Let's try that again. It's a definition. So Ondansetron is an antiemetic. So what is an antiemetic? They are drugs / medications used to treat or reduce nausea and vomiting. So Ondansetron, when you administer it in the pre-hospital setting, its main goal is to stop you feeling that kind of sickness and that feeling you want to vomit, or even vomiting itself. And when it comes to this medication in particular, Ondansetron is very effective in its job. And typically, it's the first line used. So first used medication in managing the symptoms of nausea and vomiting. There is another antiemetic that is used that I'm aware of that we can use in the pre-hospital setting, and that's metoclopramide or something like that. We will cover that in a later video, but generally, if we can't use Ondansetron because it's contraindicated, depending on what ambulance service that you work for, then we'll use the other antiemetic. But generally, this is the one that we go for. Okay, so now that we got the definition out of the way, let's head straight to the to the pharmacology. I think this class in itself will be quite quick, so that's not too bad. Just not all of them will be hopefully 20 minutes long. This one I'm aiming to try and get below 20. They tend to be a bit too long, these videos I'm making, but hey, they're all free and you have the time to watch them, then by all means go for it. So let's go to the pharmacodynamics now, and as we've mentioned in the past, pharmacodynamics is what the drug does to the body. Okay, perfect. So for Ondansetron, when you administer Ondansetron, what you need to be aware of, it is super competitive for, I'm going to do a different color for this, serotonin 5-HT3 receptors. Just be aware that you don't really need to know in detail what the 5-HT receptors are. Just need to know that it is super competitive, super inclined to attach to these receptors. Similar to the when it comes to morphine, the mu, kappa, and delta receptors. When you administer morphine, morphine will go to these receptors because these receptors are selective to morphine. In the same sense, Ondansetron is selective to the serotonin receptors. So we'll continue on with that. Ondansetron is an antagonist. We know what an agonist is. When they bind to a receptor, it produces a biological response. But if it's an antagonist, it means, and in this case for Ondansetron, it prevents the binding of serotonin. Did I spell that right? Yeah, I did. Serotonin released from the let's have that blue actually. Intestinal enterochromatin. And you don't really need to know what enterochromatin is. It's just basically in the stomach, intestinal area, my bad. Chromatin cells to these receptors on the vagal, and you need to know these areas. So vagal afferent nerves. Sorry if I'm speaking a bit slower. It's just harder to speak and write at the same time. Okay, so from here, we know Ondansetron is super competitive to the serotonin 5-HT receptors. So all you need to know in this particular instance is that it's the 5-HT receptors. So serotonin, which is released from the intestinal enterochromatin cells, which are located in the intestinal, when they're released, because Ondansetron has binded to the 5-HT receptors, it prevents the serotonin released to bind to these receptors, because Ondansetron has kind of came in the way and said, hey, we're already here, you can go away. And these receptors, the 5-HT receptors, are located in the vagal afferent nerves. Now, this is really important in the pharmacodynamics because of the binding of Ondansetron to these receptors, and serotonin can't bind then to it. This blockade effect on the 5-HT3 receptors caused by Ondansetron reduces nausea and vomiting. And this is done by decreasing vagus nerve signaling and subsequent serotonin release in the brainstem. Bit wordy, I know, but that's all important information you should be aware of. And if you need to, you can go back and just pause it and write this information down. But what is this? Why do we need to know about serotonin release, and why is that relevant to ondansetron's blocking effect on the serotonin receptors? Well, good point. You make a very good point there, even though I might be just asking that to myself. But these are the questions you should ask. It is well researched that emesis, which is, that nausea and vomiting effect, is associated, let me zoom in a bit more, with increased concentration of serotonin 5-HT. So there is research, and they did research on a certain thing of emesis in cancer patients, and they found that some medications, when they were administered, they were increasing serotonin levels in the body, and because of this, a lot of these patients were actually getting quite sick and they were vomiting. And they found that when emesis was around, or when in these patients, when there was emesis identified, they found that there was increased serotonin in the body. And so because of ondansetron's antagonist effects on the 5-HT3 receptors, serotonin release is reduced. So that's actually one of the key points I really want you to get out of the pharmacodynamics. So let's actually have that in a separate point. Ondansetron antagonist effects on 5-HT3 receptors. Perfect. Results in serotonin release being reduced. Perfect. However, an important note is that ondansetron cannot be used to treat all cases of nausea and vomiting, as serotonin signaling is not the only mechanism that nausea and vomiting can be stimulated by. Okay, so let's summarize here. The underlying belief is that with administration of ondansetron in pharmacodynamics, is that 5-HT initiated vomit reflex. So 5-HT initiated vomit reflex through activation of vagoafferents via, now this might be a bit wordy, I do apologize, via 5-HT3 receptors may be blocked by ondansetron administration. And typically, 5-HT3 initiated vomit reflex is a common cause of nausea and vomiting in the pre-hospital setting. So ondansetron is a good medication that you have in your medication kit that you can use to treat that. And I've seen it in the field that when there were patients that were administered morphine and they start to feel a bit sick or they want to vomit, then a dose of ondansetron was administered, and the amount that you would give to a patient can be dependent on where you're working and what ambulance service protocols that you're working under, so it can range. So I won't give the dosages because I don't want to be giving you guys information that might not be exactly correct in whatever field you're in. I'm just giving the basic underlying information. The activation of vagal afferents by other stimuli may cause release of 5-HT in the chemoreceptor trigger zone in the floor of the fourth ventricle, promoting emesis through central mechanisms. So this can be blocked by ondansetron administration, but I'm not going to write that down. That's just another thing that ondansetron administration can be useful to block. But generally, that's the key point to take. Main role is the 5-HT3 receptors. Okay, perfect. So now we've got the pharmacodynamics right. It's basically an antagonist that when it binds to the serotonin 5-HT3 receptors, it prevents serotonin to bind with it, and thus causing a reduce in nausea and vomiting in patients. So let's head off to the precautions. The main ones I want you to be aware of is be mindful of patients with hepatic impairment. And the reason for this is because this condition reduces plasma clearance time. And what this causes is increased half-life of ondansetron. So increased half-life of ondansetron. And because of this, there is an increased risk, a significant increased risk of adverse effects, because the drug essentially and its effects last longer in these patients. So basically in these patients, drug and its effects will last longer with these patients. So just be mindful of that when you're administering ondansetron, and just make sure you ask them if they have any medical condition like hepatic impairment, or if they have any issues with their hepatic system. Patients with risk factors for long or for QT interval prolongation or cardiac arrhythmias. I really find it hard to pronounce that word, but basically risk factors for QT interval, and this has got to do with the ECGs and all that, and I will cover that in a separate video as well. But basically, risk factors for QT interval prolongation or cardiac arrhythmias. And this is an interesting one to note, as ondansetron is known to Ondan is known to prolong the QT interval. And you'll know about this in the ECG session that I'll talk about later on in another video, as I've been mentioning. So if you're not too sure what that means and what is the QT interval and what is that, I just need to let you know that research has identified that ondansetron Ondansetron. Oh, let's go back. Ondansetron effect on cardiac ion channels in the heart suggest it is able to interact with the inactive state of cardiac sodium channels or sodium channel. And all you need to know from this point that I've mentioned is that it can act on the cardiac ion channels, and because of this interaction can cause this interaction can cause the channel to be blocked, and that runs the risk of cardiac arrhythmias, such as the QT interval prolongation. So that's the main two precautions I want to mention today. There are a few more, but again, I'm not trying to give an exhaustive list, just the ones that you should be aware of and be mindful of, mainly, especially in terms of administering Ondansetron. I hope you found that useful. I hope you found some information to be of benefit. Again, this is all completely free, and I hope you were able to learn something from today. We will be continuing on with the pharmacology classes. There are still quite a few more drugs that I need to cover, and then we'll move on to the next series that we have planned, which is going to be the medical series. And yeah, that should cover it up for today. I hope you guys enjoyed, and I'll see you guys next time.